So Western's doing big things in cancer research, and our very own Dr. Litchfield is one of those people. So if you're interested, be sure to check it out because we have an exclusive interview with him coming up right now.
So Dr. Litchfield, tell us about a bit of the research that goes on in your lab and some of the key milestone accomplishments that you've accomplished over the years.
Okay. Well, the overall interests of our lab are really to try and understand how cells are making decisions about whether they survive or whether they die, because in large part the underlying basis of a lot of diseases like cancer is that cells are making the wrong decisions about their survival. So in the overall scheme of things, our contribution has been directed towards the identification of components of regulatory pathways that control cell divisions related to survival. So at the present time, a lot of our work is focused on a detailed evaluation of compounds that might ultimately become drugs for controlling cell growth and survival.
So there's a lot of potential for sort of pharmaceutical products at the end of the research, or?
I guess in a global sense, yes. From a lab like ours, our expertise is really deciphering the decisions that individual cells are making, and if we can help identify the constituents of the pathways that are critical to these decisions, and we can use that expertise to evaluate these compounds, then we can ultimately contribute to knowledge-based approaches for better therapies in the future.
Okay. Speaking about the future, one of the things that the Canadian Cancer Society always touts as its main message is the mission statement of hope. As a researcher working on cancer treatments and cures, how would you define hope in terms of the future of cancer research?
Well, what I would say as the real hope that we're starting to see evidence of, or the proof of principle, is for molecular targeted therapy. So situations where the precise genetic basis of the disease has been identified, it's possible to use that knowledge to develop a precise targeted therapy that is directed specifically at that genetic defect. And we've now got the proof of principle in situations like chronic myelogenous leukemia, where there's a fusion protein that is abnormal, and a drug has been developed to target that abnormal protein, and that's been a very effective treatment. And so there's a paradigm that we can expect more successes in the future, where knowing the underlying genetic basis is going to lead to more precise strategies for treatment.
Dr. Litchfield, I've seen a lot of the posters and the presentations that you made over the years. Some of that research money has come from the Canadian Cancer Society. Can you tell us how important and critical that funding has been from the Canadian Cancer Society?
Well, I think the funding from the Canadian Cancer Society is absolutely critical on a lot of levels. We've got unique expertise in the international community in terms of we're able to do studies on particular pathways that aren't being done elsewhere. So that's one level. The other one that's extremely critical is the training of personnel. In the overall scheme of things, research is very much a team effort, and we need expertise from a lot of different domains. And so one really critical contribution through the funding from the Canadian Cancer Society has been on the training of graduate students. So the future generations of researchers are those individuals who are supported in large part by Canadian Cancer Society. Locally, it's a team effort. Most of the work that we're doing now involves collaborators at other institutions. Internationally, we have local collaborations, and the reality is that we are experts on these particular signaling pathways, but in the overall scheme of things, cancer is a very complex disease, and so we have to be prepared to tackle the understanding of complex disease through accessing different technologies and different expertise wherever that expertise resides.
So it's all about pooling the resources, getting all the great minds together, and making sure that something great comes out of the collaboration?
Well, ideally, what we want to do is really, capitalize on the expertise, develop synergies, and really communicate effectively so that we're not duplicating effort and that we can learn from what's happening across the world.
You were telling me earlier how two drugs that may not work as effective independently, but in tandem, they're really effective and for cancer targets. Tell me a bit more about that, and for some of the viewers, it seems like a very interesting concept.
Well, I think what's happening now is we're at the stage where we're getting a lot of three-dimensional structure information about the targets of potential drugs. And so what this has enabled is really opportunities to do structure-activity relationships to identify any drug that shows any kind of affinity for one type of target. And even if it's not a good drug, by combining that with a second drug, now it's possible to turn two relatively ineffective drugs into something that's extremely potent and selective, and so it's tremendous excitement in the field driven by our structural insights and then our understanding of how cells respond to different signals.
So that really personifies the hope in cancer research.
Well, again, I think we're back to the promise of molecular targeted therapy. If we understand the genetic basis of the disease and then understand at the three-dimensional structural level what the implications of those genetic changes are, then we can really develop precise strategies for being able to correct or eliminate the defective proteins.
Well, the field definitely seems promising. Thanks for talking to us.